when we're implementing AI and trying to make that front end better, we need to think, did we give the patient certainty? Did we reduce confusion? Did we protect the patient's sense of control? If we're thinking about the patient from those perspectives, then you're doing it right.
I'm Liat, your host, and I could not have chosen a better guest to launch this season. Jim Economou is the VP of Patient Access and Contact Centers at Endeavor Health. He has spent 25 plus years making healthcare operations more human, and he helped bring patient access together across 4 health systems into one endeavor. He happens to be also a friend, one of the most generous, energizing people I know in this industry. And Jim, welcome to the show. It's so good to have you.
Nice to have you. Thank you for having me.
Thank you for joining. Jim, so our audience can get to know you a bit, give people a quick sense of your path and what you own at Endeavor today. Before that, I also want to know how you got into healthcare.
I've been in healthcare all my life. So ever since college, just a couple years ago. So, I'm still in my 20s. I've been in healthcare. No, I've been in healthcare literally since in college. I started off as a psych major, worked at hospital psychiatric units. I was an EMT in the ER for a number of years, and eventually got into business and started working for patient accounts and fell in love with patient accounts in all aspects of the revenue cycle, actually. Front end and the back end. And I've tried to leave the revenue cycle, but it keeps drawing me right back. It seems to be my passion. I've learned from other areas. I've learned from other industries, but revenue cycle seems to be in my blood and in the core of what I feel, think, and love to work and come back to work every day.
What's so special about it?
I don't know. It seems to be a natural fit. It seems to be the area that I know I can make a difference in. And if you think about a lot of patients and family members' angst, a lot of it is the front end, trying to schedule an appointment, paying their bill. Anything that is administrative seems to be a burden. And I just want to be able to help those patients out so that it's as easy as trying to reschedule a dinner reservation.
Yep. So that leads me to asking you really, what is one thing you're working on right now in patient access that genuinely excites you?
We're implementing AI. That excites me because the healthcare industry is usually a lagger. And to finally get the healthcare industry to catch up with the other industries is exciting. And so we're in the very beginning stages of it. I always say we try to walk, crawl, run. And so we're walking, but I got a feeling we're going to be running soon. So that I'm excited to continue that journey.
Is there anything you've run into as far as a challenge that you've tackled with this whole journey now with AI that others can kind of learn from and not fall into that pit?
One of the things that I like to look at or see it from a different perspective, I even called it administrative, but I don't think it is. I think the journey for the patient from a clinical perspective starts from the time that they feel they need to see a doctor. So from the time they call or reach out to us, we're already taking care of them from that perspective. So think about everything that someone feels when they try to call today, current state. There's uncertainty. Am I calling the right doctor? They're vulnerable. They trust what we tell them. They're afraid of forgetting to tell us something. They're afraid of what the appointment might reveal. Like if you feel like, oh my gosh, do I have cancer or do I, have some sort of other ailment? What's going to happen to me financially? What's going to happen to my family, etc.? You're already feeling all this anxiety without even having stepped into the doctor's office. And so treating the patient at the beginning and understanding what they may be going through, I think is a key to implementing AI so that you're not looking at transactional type of information, but you're treating it as relational. So it's the patient's feelings and not the transaction. Does that make sense?
It does, and I'm just thinking to myself as I'm listening how lucky we are as patients to at least have you filling this role. So it's a very nice feeling that someone who is in charge of all this is actually putting him or herself in the shoes of the patient. And that's what everyone should be doing at all times, right?
Exactly. Exactly. I mean, I'm a patient.
You're a patient. I'm a patient.
You're a
I'm a
patient.
mother of kids who
You're
need doctor appointments.
right, right. And you understand that anxiety or that feeling, the vulnerability when you're calling on behalf of your child because they're sick. And
Absolutely.
so that is the piece that I think people need to not forget, that when we're implementing AI and trying to make that front end better, we need to think, how do we affect the patient in a way that simplifies it? Did we give the patient certainty? Did we reduce confusion? Did we protect the patient's sense of control? If we're thinking about the patient from those perspectives while we're putting in and implementing AI to those front end areas, then you're doing it right.
Absolutely. Wow, this whole conversation around empathy and efficiency, because you have goals to make things more efficient, but you also need to keep empathy in mind. So we can move patients through the system faster than ever now with AI and everything that you're working on at Endeavor. But speed isn't the same as care. It almost feels like it's this opposite of, right? Just get moving along. But there is someone here who is in his or her most vulnerable state and they need care. So as more of the access journey gets automated and all this buzz around AI, and not even buzz, people are actually doing it now. This is the year of like, it's in, now what? How do you protect the feeling of being cared for? So talk to us a bit, more practical. How are you doing that in your role today?
So I'm going to go back to what you just said, the speed and care. Speed can be care. So in my world, if I can get the patient and the phone answered timely and the patient doesn't have to wait 20 minutes on hold, that's speed. If I can get the full appointment taken care of within minutes, that's speed. If the patient doesn't have to even pick up the phone, if they just go into an app or online or however they want to access us at any time of the day, that's speed. So speed is care if you look at it from that perspective. I just want to make sure I pointed that out, because a lot of
Totally.
people think of it as, like you said, all right, next, and
Yep.
it, but that's transactional.
Exactly. So
But
it's
if
finding that balance as you implement AI is really that balance between,
making sure that you're keeping it relational,
yep.
not just transactional. If you forget about that, then what you're talking about is exactly what's going to happen.
Absolutely. And it's funny how we're all implementing, well, you are all implementing AI with the goal to have more empathy, provide more of an empathetic feeling for these patients who need care at their fingertips in real time at 12 a.m. when no one's at your call center. And you're doing it with AI, right? Not with a human. So it's just an interesting time in life now to see and in technology. So what does that look like now for you specifically? Are you able to share this project that you're now working on at Endeavor?
Not ready to, but I can share a project we did start that's not necessarily my project, but it kind of coincides with the empathy piece of it that we forget. So typically you're in a doctor's appointment. I'm going to fast forward. You already scheduled. We got, my world is perfect, right? Let's just get that. And you're in the room with your child and the doctor is got their laptop in front of you and they're asking questions, and then they're back looking at their laptop, and it doesn't feel like they're really paying attention to you or your child until it's time for the actual physical exam. But a lot of times they're very busy typing. At Endeavor Health, we've put in some AI. We had 250 of our physicians trial the AI autoscribe, and we have expanded that to 1,000 licenses to continue expanding that program because of the feedback we're getting from our clinicians, because now the physician is able to look at you the whole time, now with your permission. They don't just do it, they ask for your permission. I don't know if you've had this luxury of being part of such a
Not yet. Not yet.
it, and so
I have not been
there's
looked in the eye in a while by a physician.
so imagine that your clinician now is taking that time empathetically and looking at you and your child and answering your questions, you feel like you're being heard. You feel like that time, let's just say it's exactly the same time. If it's 10 minutes, that 10 minutes was worth that full 10 minutes. And it felt like, all right, I feel like they listen to me and I now have, a care plan, etc. You still have a care plan if they're typing, but it doesn't feel the same. It feels doesn't feel empathetic. So AI is helping take away some of that work and reprioritizing the care so that the focus is on the patient.
So, broad question, why isn't everyone doing this?
AI is not perfect, and so you have to still review your dictation. But this is no different than dictating. When you're dictating to other type of technology, and you still have to review your notes. So you have to review your notes. Patients also are reluctant to allow taping. And so, mind you, you can stop taping at any time because a lot of times you're saying sensitive things and you don't want that to be on tape. And so it's a balance. But overall, the more that you see providers doing it, and providers can choose what patients they feel comfortable or not comfortable with this technology, but it's a start. And I think that it's headed in the right direction as long as you're using it correctly. It's like any other tool. Are you using your butter knife to screw in your screw, or are you using your screwdriver? Now, if you're using your butter knife, you're not using it correctly and you're going to get hurt. So,
I agree with that, but in healthcare, I do think we also can use the right tools, but it's just because of the safeguards and patient privacy and guardrails that are needed. You have to wrap it up with so much more than any other industry. So you're really at this challenge that
yes,
everyone's facing right now.
you're absolutely correct, Leah.
Speaking of challenges, what is one thing that's keeping you up at night?
One thing? Okay.
I mean, we
That's
don't have
yeah.
9 hours, but I can call you after.
That's a challenge in itself. So there's a couple challenges that come to mind. I'm thinking here. One of it is making sure that everything is seamless. You could put a lot of things AI in place, but if they don't talk to each other, then and it's not seamless any longer. And at Endeavor Health, our vision is safe, seamless, and personal. We always have to make sure that when we're implementing any technology or bringing in a business partner, if it's not safe, if it's not seamless, and if it's not personal, then we can't continue to move forward with it. So from a seamless perspective, think about it as you start on your app and you have to then switch to a phone call. If you have to repeat yourself all over again, then you lost the game there. You have to be seamless and you have to have multi omni-channel cohesiveness and so that to make this work. And that's hard. And that keeps me up at night because it's easy to put things in place. It's hard to make it seamless. Here's an easy way of thinking about it. Think about you got this brand new tool. It's state of the art. It's like the best thing since sliced bread. If you integrate it with old technology and old workflows, you're just enhancing old workflows as opposed to creating new, improved optimization type of workflows. Is that you see what I'm saying? You
Absolutely. It's
you
all about
can't just think
interoperability.
that new gadget's going to do the trick. You have to go deeper and ensure that everything is talking to each other and working well.
There are a lot of expectations coming at you, almost unrealistic, to be honest. If everything has to be safe, seamless, and personable, what was the last one?
Personal.
See, I am a good listener.
Yes.
Then that has you moving pretty slow. How are you handling all of that?
Slowly walk, crawl, run. Remember? So as long as you remember that, okay, we're walking and no, walk, crawl, no, crawl, walk, run.
We're
See, I had it right.
crawling. We're
We're
still crawling,
crawling.
Jim.
We're crawling. You got to, it's like not anything else. You got to get up and put one front foot in front of the other. You got to keep moving. You got to keep, and it can't be perfect. You make your decisions, you move forward, you adjust, you pivot, and then you continue to make improvements from there. If you don't try to do that, then you're never gonna be able to get there. So
And you will fall behind.
and you will fall behind. One of the things that I had trouble with is that whole idea of getting approval to put AI in place from a financial perspective. What's your return on investment? Well, it's kind of like, well, what is our what happens if we don't invest? So, to your point, falling behind. If we don't do this, then we risk the financial loss of falling behind. So, you got to kind of look at it both ways. What is it that the patient wants? What is it that we're trying to address? We can't just do it for the sake of doing it. It has to make sense for your organization. It has to make sense for the community that you're serving. If you don't take that in consideration, then you're failing there as well.
So, what is your team doing? Your team is probably very busy and making sure that every implementation is safe, seamless, personal, works well with interoperability in mind at all times. What is a success story that others can learn from listening in that really kind of, we did this right with everything going on with AI and everything that we have to consider? We did this right. What is one piece of advice you can offer folks who are in this now, in the same ship?
We're slowly integrating. So when you have a large organization, you may have multiple instances of your EHR system, multiple telephony systems, different training programs, centralizing not for the sake of saving money, but for the sake of standardizing and making workflows so that the patient has the same experience regardless of where they go. That's the thing that we're working on. So my department has centralized what they can, and we continue to work on it and continue to centralize. So overall, those areas that are centralized, we can prove with our metrics. Hey, look, this is what we're doing. This is the feedback we're getting from patients from Press Ganey surveys. We're noticing a difference. And as they notice a difference, more departments hop on and say, well, we want you to do this for us. And it just keeps growing from there. Having the right relationships and trust with your operational leaders, your clinical leaders, and your technical leaders is also key. So making sure you're listening, not just pushing and doing something, that you're considering everyone's insights and making sure you're addressing them. If you're not addressing them, then they're not on board. If they're not on board, nothing's going to work.
Absolutely. You have to have that internal buy-in and trust. And you mentioned metrics, Jim. So, what is your framework for measuring success? Everyone's trying to measure ROAI. What's been working? What's not working?
So there's so many things you can measure. Like you can measure everything. And you start losing vision when you're looking at everything. You still have to have all of that, but what are you communicating to the rest of the leadership out there? So we try to keep things minimal and also a positive twist so that they still are getting metrics and they still are understanding their call centers and what they're doing and leaving us to dive into the details. So for instance, the average speed to answer, it's a very common metric. That one they know, and that's easy one. Abandonment rate is another one, but we don't call it abandonment rate. We flip it around so that we call it the answer rate. So if your abandonment rate is 5%, your answer rate is 95. So we want to flip the narrative around and say, what is your answer rate? You're answering 95% of the calls. Well, you should be, answering 98% of your calls. How do we get there? As opposed to abandonment rate. Everybody abandonment. It's a negative term. And so we flip that metric around. So those two metrics we populate throughout our organization dashboards so that everybody has that for all the call centers. And then if they want to know anything more specific, we can dive into the details and we can do other metrics that we can actually handle. But don't share everything because then that gets too murky. The waters get too murky.
Yeah, I just created a Salesforce dashboard and it told me you can't have more than 25 widgets in there. And I'm like, okay, I'm losing sight because I'm like, ooh, now let's show this. Now let's show a bar of that. So you're absolutely right. Keep it simple so we could see the picture and achieve the goals we're actually here to achieve and for the
Right.
patient. So,
Exactly.
yeah,
Exactly.
yeah. What is your biggest call driver?
My biggest call driver.
What are patients calling in most about? Is it scheduling? Is it billing?
Our call centers, 80% ish of the calls are calling to schedule an appointment. The other 20% are everything else. And that can come from non scheduling calls, non clinical calls. So, what time was my appointment again, or something of that nature, to clinical calls. I need my prescription filled. I have a question about, the symptom, etc. So AI is helping us with that, and we're working on routing the call to the right person so that they don't have to repeat themselves. So the number one call is scheduling, and that's what we're doing. We are noticing that our self-service metric, which means that the ability for a patient to schedule themselves in another way, is going up, and our calls are going down. So that's a good thing because then we can refocus and transition our attention to other areas and other omni channels. So, for instance, we haven't stood up live chat. And so that's something on our docket to move to. So we need to get live chat up and running and then offer it 24/7. So things of that nature. That answer your question, I think?
Absolutely. I mean, I'm curious to know how you are handling your call center AI, but if it's something that is still premature to talk about, we can connect in a year. And I just think many are facing the same situation and are eager to hear from peers and not vendors, right? Like what is
Yeah, I
actually
think
working out there?
so we're putting AI in several different areas. So we're not just putting AI in for the patient. We're putting AI in also for the agent. It's as well. So think about we've simplified things. Patients are able to schedule themselves easier. Patients are able to do a lot of things that don't require an agent. Sometimes even a bot can handle your easy question. But having AI knowledge base helps then that agent handle the more difficult issues and questions. And so we have put in AI knowledge base that when the patient says something or the agent says something that is in our knowledge base, that knowledge article or tip will come right in front of the agent so that we can either script it right or help the patient get through whatever we're at, asking, or if it's a difficult something difficult to schedule. It's a child with anesthesia guided, MRI. I mean, something that let's say not is not normal or not easily schedulable for someone that's let's say new to scheduling world. Putting that in front of them, relief. I can schedule the patient.
Totally.
And so AI can be put in various different areas, not just an AI bot, not just deflecting calls, but to also help the agent do their job, feel comfortable, and reduce turnover rate
Burden
and
and
burden.
burden.
Yeah. Yeah.
It's funny, our customer, they actually have a cardboard cutout of their AI agent and they dress her up on holidays and office parties. And she really is like part of the team because she's offloading all these repetitive tasks that they don't necessarily need to deal with. And when things get complex, she escalates it to a live agent, but she really is part of their digital workforce. So it's really cool to
Well,
see.
that's a great idea is have a competition and let staff name our agent.
There you go.
It's a great idea.
Should we call her Devi?
We-
Aliyah or Endeavor, well, I'll have to think about it, but it's really nice to see.
Yes, and we also you mentioned a she, and there's been studies that people hear a male voice better than a female voice, and we're kind of playing around with that, trying to see which is better. We have a female voice now, and but we're as we're learning and others are sharing their journeys, they're telling us that a male voice. So I'm curious to what others are experiencing with male voice, and we might actually switch for a little bit to see how that works out as well. Maybe we'll have two names agents, one
Yeah.
one male and one female.
Can I be on the advisory board for the name? Because I have to be part of that. I cannot
Absolutely.
wait. Yeah, I personally prefer a male.
Yeah, and when I do my directions wayfinding in the car, the app, they're the male and the male English accents from the UK. It's like
Yep.
I love that. Just
Yep.
talk to me and tell me where to go.
This is all great. I want to get to know you a bit more personally with the last few minutes that we have. So, my first question is in your role specifically, when you look back, because you've been doing this for 25 years and you know the ins and outs more,
I'm old.
you don't look it. What's the mark you would want to leave on patient access, whether for the health system, the patients, both?
The mark I want to leave is one more of people see that's what we should be doing and not reverting back. So if you think about a lot of times when you put new workflows in place, the first thing that happens when someone leaves or moves on is people revert back to old habits. How do I make my mark where they don't revert back, they don't even look back, they're like, well, why would we go back? Think about, we all have smartphones now. Are you ever going to go back to a rotary dial or a corded phone? No, I want to be the same thing, but in the patient access healthcare world, where it's the, of course, it's the natural way to move forward, not revert back.
And what would that look like then? What is something that you would want to implement? You know, you have a magic wand. It's the end of next year. We're chilling at our Becker's dinner that you're a VIP member of each year. And you're telling me about Endeavor and where you guys are. What does that look like?
Think about what I said about safe, seamless, and personal. And then at the beginning of our conversation, we talked about speed. You're wanting to reschedule your MRI. You pull up, the app, and you just say, I need to reschedule. The app knows you because your phone number, it may have to validate something, but it knows you and says, oh, Leah, I see that you're scheduled for Tuesday. Is that correct? Yes, I need to reschedule that. Well, here are some alternative dates. Which one would you like? And then it gives you those dates, and you tell it. And then it goes in and looks to make sure your prior authorization is not affected, because prior authorizations are only good for so much time. It looks like you're all set. We have you already prior authorized, etc. And it's smart enough to know that if it doesn't, it will tell you that unfortunately we need to reach out to your insurance company and see if we can extend this. All this, you haven't done anything other than go to your text and say, I need to reschedule my MRI. How do we get to that stage where it's as easy as open table and in your or Amazon? How do we get there? That would, to me, would be remarkable. And that's where I'd like for someone, I don't care if it's Endeavor or anyone else, but we, as a healthcare industry, we need to get there.
It's like instead of the patient chasing after healthcare, healthcare is wrapping around the patient, wrapping
Yes.
itself around the patient. Patient is in the center. We at Hyro call that scheduling negotiation. And it's really nice to see how just the AI agent thinks it keeps taking it a step further. Like, hey, you're also due for an MRI. Would you like to
Yeah.
schedule that as well? Or monogram, like
Yes.
mammogram. So it's really nice to see how we are actually proactively enabling the patient to self serve and to think about what they need to check as far as their age and when their situation.
That makes me think that's a great point, because that makes me think more proactive than reactive. And take that a step further and say the system's smart enough to know that you're due for something. Reach out and say, hey, Leah, you're due for this,
Yeah,
instead of while I have you on the phone, but to be more
absolutely.
proactive about Leah's health or Leah's family's health. You know what I mean? And
Absolutely.
and so that that whoever Endeavor Health or Smart Health or whoever is reaching out to you proactively with AI is meaning to do that because they have the best intentions for your health.
Not only for the patient, this is why we call it proactive PX, not only for the patient, but also filling in slots for the health system and booking appointments. And it's just a win win all around. And it serves so many people in the health system, the call center agents, the patients themselves, the C level, the ROI that you see on implementing one tool that then has this exponential effect. And it's great to see. So, anyway, with that, went down that rabbit hole. But is there anything else before I have my fun question to end with? And I love
Ooh,
ending.
no,
Is
fire
there
away.
anything I will fire away, but anything you want to leave folks in your role as food for thought? We're ending this awesome episode. Any food for thought or piece of advice you'd like to leave folks with before we hear some fun things about you?
I'm going to be dorky and say be a pioneer. This Patient X pioneer. It's what you're calling the podcast. Be a pioneer. Go out there and do something. Try to make it better. Status quo is no longer status quo. So that's what I say. Go do something.
Do it, but make sure it's safe, seamless,
Seamless
and
and
personal.
personal.
Yes. Jim, well, my question really is my own kind of agenda because I hope to see you in person one day, and this
No,
is what I want to know. What are you waving there? Star Wars? I love it.
it's my green flashing little toy. So whenever anything positive is happening in my office, I wave this little toy. 'Cause you can't see it that well.
Yeah, virtual background getting in the way. But would you send me one that has the logo on it? And can you find the time also in your busy day to make that happen? Jim, I am so excited to see you soon in person at all of our events and everything. I do want to ask you this one fun question. If you could see one band, dead or alive, perform live in any city you choose, who's the band and where are we going? I know it's a hard one.
Pearl Jam, I've already seen them, but I'm gonna say Pearl Jam because I think that they're wonderful. But I can also say other older bands, but let's just say Pearl Jam. And where would I want to see them? I think the UK.
Ooh, okay, you're traveling far.
Okay, well, I didn't think that was that far.
Not that far. Well, mine is Pink Floyd in Amsterdam for all obvious reasons. And with that, I'll see you
That's
in the
awesome.
UK. We
Thanks,
can
Leah.
dream, can't we dream? Thank you, Jim, for being a patient access pioneer. Really, truly, that is how we all see you. And I appreciate your time, and we will be in touch soon.
All right.